right, some of you may be sitting there wondering, would chiropractic care be beneficial for my children if they had an ear infection? And we would like to talk a little bit about that. We often have patients ask me, they'll come in and say, I have a child at home who's sick. What could you do? Is it something that chiropractic could help? And we tell them absolutely. We would recommend getting the child in right away to get it checked, to evaluate the cervical spine, the neck area, to see if there is any nerve interference or what we call the subluxations in that area. We saw with our own children, we raised 3 kids, and during their younger years and even up into their teens, never had an ear infection or problem that continued because of the chiropractic care. And with nutrition, keeping the kids off the dairy and off the sweets helped their immune system work more efficiently. And just recently we had a patient who called up and said, I can't make it in, my child has an ear infection, I need to stay home. And the staff told him, you get in right away, bring your child with you, let's get her checked. And so she came in, we were able to evaluate the spine, we found that her neck was out of alignment in the upper cervical area, and she had spent the last few days at home with staying awake at night, was crying because of the pain, had went to the MD, they put her on antibiotics, it hadn't changed the pattern. And the mom was so frustrated because this is the 3rd time she had been on antibiotics in the last several months. And she said, what can I do? I'd like to do something different. I want to take more of a natural approach to this. So we started working with the adjustment. And to her surprise, mom came in the next day. I can't believe it. She slept all night. And she was so happy because mom got to sleep all night. And the baby was in the next day. Fever was less. The ear pain was very minimal, and we worked with her over a period of time, and we saw that resolve, and came back at a time a few months later, and again, with the chiropractic and the specific adjustments in the upper neck, it made a huge difference.
So she was on antibiotics. She had been on Augmentin, vancomycin, which is a very, very strong antibiotic, and she had been on and off of those for a long, long time, had no immune system at all when I first brought her into Dr. Moore. Constantly sick from all the antibiotics, and hasn't taken any antibiotics or has not even been sick for the last 2.5 years, which has been amazing because, like I said, she had been in and out of the hospital. She's been through surgery. She's just been really, really sick, but Dr. Moore has really 100% brought her through.
So for those of you that may have children with problems at this time or would just be interested, I would suggest talking to your chiropractor, find out from them what it would take to get an evaluation, determine if there is a problem in the upper cervical that may be able to be benefited with chiropractic, and I think you'll find you'll be very happy with the results.
When I first talked to Dr. Moore about adjusting her for her ear infections, I was very skeptical and wasn't too sure about it, and I brought her in, and I'd say within the first week she quit complaining of ear infections. She all the pain had gone away. I would bring her in, she'd be crying, and he would adjust her, and she'd just clear up from it, and she's been healthy ever since.
I know we have many patients we've worked with through the years, and we found it's one of the very successful stories that we have to share. And some of our patients might actually, share some of those stories with you. We also would say that for parents, they don't often understand with a little baby, even an infant, a few days old, a few weeks old, there are problems in the neck area that can cause symptoms you might think about or might not think about. With sinus problems, the inner ear, sometimes a swelling of the eustachian tube will close off the inner ear, sometimes upper respiratory problems. And we can look at the spine itself and actually see where the origin of that is. From a chiropractic standpoint, normally the spine would be straight from the back and you would have a normal curve forward in the neck. The specific vertebrae that control the nerve flow into the inner ear and the sinus and throat area come from the upper cervical area. And if we evaluate the spine and find that this region is out of position, that stress or irritation on the spinal nerves or on the spinal cord directly can interfere with the communication that the brain would send back to the sinus area, to the throat, to the inner ear, to help the body provide the natural immune response that it should have. If there's a subluxation or nerve irritation in this area, it diminishes that nerve flow, so the body isn't able to respond as well. And you may not realize how critical that is, but that is many times the underlying cause for the weakness in the immune system. So if you want to do all you can to help your child in that way, that would be very, very important to speak to your chiropractor about that, to have that looked at. As we can see on the chart, there is also connection from the atlas area into the whole sinus region, upper cervical area, and it shows very specifically the problems in that area. The other thing that parents often, they get very frustrated with repeat visits to the family doctor for the ear infections.
I was a patient of Dr. Moore's, my chiropractor. I was currently being seen for a ruptured disc in my back, and my daughter at the time had started preschool. She was 3 years old and started preschool, and she started getting chronic ear infections from the day that she had started preschool. So she took her to my medical doctor, and they had, for the first ear infection, put her on antibiotics. Then the second month went by that she was in school, and she once again got another ear infection, and then again took her back into my medical doctor and once again put her on antibiotics. The third month she got another ear infection, did the same thing, did the antibiotic route, and the fourth time, 4 months, the fourth month in a row, I decided this is ridiculous. I cannot continue to put her on antibiotics every single month. It's not healthy for her. It's not good for her immune system. And I talked to Dr. Moore, my chiropractor, about what some options were for her to help her get through her infections. And so he had me bring her in and described what chiropractic care could do for her, and told me about having her adjusted and bringing her in on a weekly basis, and what some of the symptoms she might experience right after being adjusted. And instantly her ear infection went away the first day that we had taken her in. And subsequently, since being in school and being exposed to different bacteria and so forth, she started to get sick again the next few months again, and brought her back in, and once again she got better from chiropractic care. And I have another daughter who's 6 years old. She too had been in school for quite some time and started getting just the regular thing, getting sick in school. Brought her into chiropractic, Dr. Moore, my chiropractor, and she got better all by herself without having to go back to antibiotics. So I am a firm believer of chiropractic care for treating our children and giving them another alternative for a healthier life.
What we have found is that not only is it important to have the child adjusted when they have an active infection or have a problem, but we encourage our patients, as I'm sure your chiropractor would, to have the kids evaluated, do a posture evaluation, check out their spine, see if there might be a specific region or area that is out of alignment. If you can correct the problem, like your spinal problems they do begin as children. As we develop through the years, simple falls or injuries. A young lady was in today, just fell off her horse, and lands on her bottom and rolls around and gets up like there's no problem, but what you don't realize is many times the spine has been knocked out of alignment. If we can catch those problems early, help to correct that alignment at that time, restore the normal function of the nervous system, we find that's the best remedy to these problems. Let's not wait for our children to be sick, to develop the ear infections or the sinus problems before we do something to help correct that. So I would encourage you to, like I said, speak with your chiropractor, think about it. I'm sure he has some literature he could provide for you. And the more active you can become before there is a problem, the less likely you'll have to deal with this as a parent and stay up through the painful nights with these little kids.
Because I used to cry and cry over my ear infections and everything. And it would hurt really bad, where it feels like somebody was stabbing you with a needle. That bad.
She doesn't run fevers anymore, no more ear pain. She's just been really super healthy since she's been coming to Dr. Moore.
It's very often something that we find once parents have started care and they've received the benefit of this, what we find is we'll get phone calls. The patient will say, well, my child has a little runny nose or little sniffles. I'm coming in. They don't ask, is it okay or is it a good idea? They say, I'm coming. And we find that's fantastic. We can catch these things early when they first begin, get the child adjusted, help to improve that function of the nerve system. Many times these never develop into full-blown ear infections, or the sinus problem that was going to become more serious, or a bronchial discomfort never develops. And that's really the lesson. Prevention is the key.
Our children love to come in to see the chiropractor. It's a wonderful experience for them. they love the routine, the experience. They feel better coming in, they feel healthier. And our whole family now is coming in and having chiropractic care on a weekly basis.
It's the most important part, and as you change and begin to create a lifestyle that provides the proper nutrition, proper diet at home, those things help keep the immune system stronger, prevent many of these problems from the get-go, avoiding the problem down the road. So next time you're sitting out there in the front room, grab that literature about ear infections and take time to read that. Ask your doctor. I'm sure he has much more information about specifics and could also provide that information for you and hopefully be of a tremendous benefit for your child. If you do talk to others, and often you're sitting around for coffee with friends or you're at school functions, if you know a friend that has a child that is sick or has ear infections, don't hesitate to say, listen, I know my chiropractor works with a lot of different conditions, a lot of different problems. These are specifics that you might tell them, and invite them to at least consider chiropractic, give them an opportunity to take a more natural approach to their health care. You'll be very happy in the long run that you've done that.
I get adjusted and I feel good after it. And when I get done and I go home and I just relax and everything with my family.
And if you can restore the body's natural ability to heal itself, by far the best benefit you could ever provide as a parent.